So I introduce now Kurt Stange. Kurt is a family physician who's been practicing for many years. He's done a lot of work in family or in system design in primary care. He's the editor of the Annals of Family Medicine. He and his team did an incredible amount of work preparing for this, and we're happy to have him and honored to have him participating with us today.
Thanks, Steve. Erica Breslow, Alan Dietrich, Russ Glasgow, and I contributed equally to this work. We actually developed a method for the madness of trying to synthesize this diverse literature. And so the method started with those of us who were on the team. We tried to develop a team that would have a multidisciplinary perspective to look at the literature from different angles. We did multiple iterations of literature searches that were designed to include the breadth of the field, concentrating on the cancer control continuum, but also trying to inform the literature search from other fields of multi-level interventions. And then we developed a matrix of article types and tried to make sure we had filled in that matrix. So there were three dimensions of that. There were cancer, non-cancer articles, intervention and observation articles, and then three levels that went from theory to methodological work to empirical research. And then we spent 3.5 days immersed in this literature, getting it down to about 45 articles that we thought were worthy of particular input. And we did this where there were no distractions except for the overhead noise of airplanes and really bad food at one of the Chicago O'Hare airports. And our goal there was to really characterize how multi-level interventions are currently conceptualized and implemented in the literature, to describe illustrative examples, and to identify opportunities for multi-level interventions to advance cancer control. So I've got a couple slides to characterize this literature, 3 slides on these opportunities, and then one closing slide of the discussion questions we'd like you to consider. So we identified 3 large threads in this literature. The first are a large series of contextualized single-level studies. So these are studies that typically intervene on one level, often the individual or the practice or provider, but they actually consider other contextually important levels. And in some way, this is not part of the charge of the conference. And yet, if we think of where the literature is now, where mostly we have intervention studies that just look at one level, this would be a huge advance if those studies that were targeting one level actually just put that level in context, maybe gathered a little data on some of those other levels, put that single level in a larger theoretical context, and interpreted the findings in that. So as we're thinking specifically about multi-level interventions here, there's also an opportunity to think about single-level studies that we actually put in context, and there were a lot of studies that started to try to do that. There was a large body of literature of health system research, and actually the work that Steve Taplin did when he was at Group Health of Puget Sound, and that many others here in the HMO Cancer Research Network and others have done. These studies typically include interventions at the individual and the practice level, often at the system level. And this can be done because these integrated systems actually really have access to data, and their business model fosters them thinking about those levels. And they also often have sufficient community context that they can involve that level, or that they consider the local or regional health policy level. So there was a large body of literature from these health system intervention studies. And then finally, we saw a lot of studies that were community-wide studies, and we've heard references to a number of those as well. These studies actually typically took a public health perspective, but within that larger frame, looked at healthcare system, family and individual level interventions, practice level interventions. And because of that public health perspective, when they looked at individuals, sometimes they were thinking of them as patients, but they also were able to consider that when we're thinking about things that affect health, it's not just when they're patients in healthcare, but it's about living the rest of their lives. And within this, we focused primarily on the cancer control studies, but there really was a large body of learning that can inform this field from really 4 generations of community-based heart studies. So this is a single slide that characterizes our observations from this literature. The first observation is that multi-level interventions are inherently context-dependent, but context is inadequately reported in most reports. And this might be because often these multi-level studies are large studies and they're published over many papers over time. But reading this literature, you don't get enough of a sense of context often to think about how you might apply these into different settings, or how you might think about how the levels interact. Often less than 3 levels are reported. We found a large body of literature that were theory articles, but when we got to the empirical literature, often theory was briefly mentioned, but it was really hard to see how it was used to actually guide the intervention or to interpret the findings, or how the empirical findings actually went back to reinform and reinterpret the theory. Across the cancer control continuum, the vast majority of studies we were able to find really focused on the prevention and early detection end. A few were on the survivorship end, but very few on the diagnosis, treatment, end-of-life care of the spectrum. And one question is that because these multi-levels are less important for those studies, or is that because those literatures are blind to these other levels that might be affecting the phenomena that they're studying at those levels? Reporting of temporal issues, the idea that often there's a life course perspective on the people in the study, or that the different levels of environment change over the course of the study, those temporal effects there was very limited evidence of reporting of those. And across this literature, there were lots of glimmers of hope that this is really an important area, that these multi-level interventions are where we need to go, as Steve has talked about in setting up this conference. But it's mostly a hope. And when we look at how we publish things and how we fund things, often those are really at odds with what we need to do to really advance these multi-level approaches. So looking at the opportunities that we can draw from this literature, we organized what we found in the literature in 3 areas. One is in design, next is analysis, and finally dissemination. So in the design of studies, there's a need for multi-level studies to just consider contextual factors across these levels and across time, how these things evolve as they interact over time. There's a need for designs that really involve rapid learning over time, that are dynamic and adaptive, and really open to the emergent phenomena that happen when you're looking at the interaction across multiple levels. There's a need to specify the interfaces among the levels. Often these were just alluded to, that they weren't really specified. And I think of the papers we're going to hear at this conference, Brian Wiener's a paper that really talks about, gives us a way of explicitly articulating those interactions is very important. And then finally, specifying the levels affecting the phenomena under study, even when they're not explicitly focused on. So just in the theory and the framing of the question, the interpreting of the results, to acknowledge that there are these other levels that are affecting the phenomena is important. In the analysis across the literature, we saw a greater need to evaluate both process and outcomes. And some of the exemplary studies that we did didn't just treat all those intermediate steps as a black box and look at an intervention effect on a distal outcome, but really looked at how these different levels interacted over time, how that process evolved over time. In order to do that, there's a need to capture measures of central tendency, but to move beyond that. And one of the ways to do that is with mixed method designs. So studies that do quantitative analyses, quantitative modeling at levels where there are sufficient data and sufficient variability, but then not just ignoring other levels, those higher up levels where there might not be sufficient numbers or sufficient variability for modeling. That's where a mixed methods approach that really uses qualitative methods can be really helpful. And the qualitative methods also can be helpful in understanding the context for how some of these levels interact. And then Joe Morrissey is going to tell us more about an opportunity we saw in the literature for a more complex system and simulation modeling. And then finally, in translation, there's a need for more transparency in the reporting of contextual factors. And Elizabeth Yano is going to talk to us more about this. We saw a need in the literature for moving beyond our reification of fidelity to the intervention to ways of thinking about interventions that are locally adapted, that are reinvented, that evolve over time, and that include participatory approaches. really moving beyond this idea that we're trying to discover interventions that can be sustainable to discovering principles and approaches and intervention opportunities that we can articulate in ways that can evolve over time and in different situations and setting, and then to report that in a way that others can use. I'm going to close with discussion questions that we hope you'll consider in your groups. First is the question of how do we develop multi-level interventions that create synergy across these multiple levels, where the sum is greater than where the whole is greater than the sum of the parts, that continually pay attention to context and that adapt and learn over time. And another way of seeing this is how do we develop designs and analytic techniques that reflect the complexity of the phenomena we're trying to study and trying to influence. And then how do we disseminate to foster informed adaptation or reinvention in local context and continued evolution and learning? Thank you.